Officials in Boston are contending with mixed feelings and mixed messages about the reopening of school in September. Some parents are clamoring for in-person education, while others are worried about the risks of school buildings, even with new safeguards. Among those calling for better safeguards and more supports is the chair of the Education Committee for the Boston City Council. We'd like to welcome Councilor at Large, Annissa Essaibi-George. Thank you very much for being with us, Councilor.
Thank you for the invitation.
Councilor, what about what you're hearing from parents? I mean, I think there are people who probably have some pretty strong opinions about this. So what are they telling you?
Yeah, well, we're hearing a little bit of everything. And as a BPS parent myself, there's a lot of concerns around the reopening or not reopening schools come September. And for many of the families that I've heard from, the concerns are, yes, we want school to reopen, but we want school to reopen safely. Yes, we appreciate that we're dealing with a crisis and a pandemic, but how important, it's not so much, I hate to even use the word but in there, but we realize and recognize that for so many months now, our kids have experienced a tremendous amount of learning loss. So how do we balance the needs of our children, our response to a pandemic during this time? And it continues to be a difficult time, and we're doing our very best to sort of maneuver the system as it is.
Well, one thing I've seen, and I think this was in a survey done as part of the planning process around reopening, there is a sort of a racial divide in public sentiment about this. And I think there seems to be more hesitance about in-school learning among Black and Latino parents. What do you take away from that?
Well, we've looked at some of the survey information that the superintendent has shared across the board. Our district, has done some questioning of families and school communities about their desire to return to school. And we are seeing some differences among different ethnic and racial groups. And it's really important to look at, because when we think about where our kids are in school across the district, the quality of the facilities that they're in, and the real worry and the impact of this pandemic on different racial groups. We know that it has indiscriminately impacted so many of our families, but in particular, our families of color, our Black and brown families, have felt the brunt of this pandemic most severely, and has impacted their lives quite literally, and their health most specifically. We also see that many of these families are also in communities that don't have access to high quality schools. So when we talk about the challenges of getting back to school, we realize that this is really a conversation about making sure we have high quality schools across the district in every neighborhood. What I think all of us would argue is a need to make sure that every school is a high quality school.
Well, there has been a lot of talk about toggling back and forth between in-person learning and remote learning, rotating the students different days of the week. But you've expressed some reservations about doing that across the board. Why?
Yeah, and I'm absolutely supportive of a hybrid model that includes an option for kids to either opt into being in our classrooms or opt out of being in our classrooms, because we know that certain populations are vulnerable if there are underlying health issues. But we also recognize the need, especially among some of our students with some more significant special education needs, to be in the classroom, and how important it is for our kids to be in those spaces with educators, with school staff to support those needs. Right now, the work that's happening at the school district is trying to figure out what this hybrid could look like. There's this conversation around a hopscotch model. Part of the day, part of the week, one group of kids are in, part of the other part of the week, another group of kids, with Wednesdays off for that deep cleaning that needs to happen in our schools. As I understand it, this next week, that the district and the superintendent continues to have some of these public discussions, that the surveys continue to happen to understand the desires and the comfort level of our families, of our staff, of our kids. So there's a lot of challenges with all of these models, and it is unfortunate that it's so hard to truly understand what September might mean for us when it comes to the future of this virus. But we also recognize the tremendous need of our kids and their academic experience.
Well, there are countries around the world that have schools up and running. And then on the other hand, there are people here who worry about the state of the school buildings. You know, my recollections of school buildings in Boston, they're not all that picturesque either. So what about those concerns?
Well, the quality of our school buildings certainly has been a topic for a lot of concern, especially over the last 4.5 years in my time on the city council. We've had numerous hearings around Build BPS and the facilities plan. And a lot of that conversation has actually been around these World War II buildings, where we actually see firsthand that it's the newer buildings that have some of the more significant challenges when it comes to air circulation and the ability to open windows. Some of these newer buildings, we can't open those windows. And the CDC has certain requirements around what classroom experience should be when we think about it from a facilities perspective. And the requirements that are coming down from the CDC that are being filtered through DESI, unfortunately, continue to change. So we're trying to plan based on some changing criteria. And that too adds some difficulty. But as long as we have students center to our decision making and their needs center to what we're doing as a district, and obviously the role of the teacher is so critically important in those conversations to see how do we make school happen for our kids in a safe way. Also recognizing that we don't want them to lose. None of us want our kids to lose the important time that they need to learn.
Yeah, I want to have you dig into that a little more, because you did point out some things about remote learning so far this year that were praiseworthy and encouraging. But on the other hand, there's something like 20% of the students who were not plugged in at all. So what about the dangers there?
Yeah, we have learned so much about what we've talked about for a long time, and that digital divide that exists across our city, across our neighborhoods, and has unfortunately impacted some of our lowest income families, and the needs of us as a city to respond to that are critical, because we know our kids have not, so many of them have not been able to log in to that remote learning. And for many families, that experience this spring was negative. And so we have so much work to do to make sure that school can happen in person, but also realizing that we need to also strengthen our ability to deliver school virtually, because we know with the predicted surge that we will likely experience some sort of additional shutdown later this fall, early winter. That certainly is a real risk. But at the very least, I think we're all in general agreement that there will be a hybrid model of some sort. So the virtual learning needs to continue in some way. It will. And we need to make sure that kids can access that, because the logging on and the data that we have heard quite a bit about sort of in the general public is that logging on was really difficult for so many of our families. And we have to improve both access to the technology and the delivery of academics and other supports to our kids across the district that way.
What about the concerns of nurses? Because some of them are worried about having a sink and a place where you can isolate a student if they might be sick. What about that?
So a few weeks ago, I was able to meet with a number of our school nurses. And as you know, Chris, school nurses are so important to me. I fought the first few years of my time on the Boston City Council to make sure that we had a full-time nurse in all of our buildings. And this pandemic has demonstrated that a great deal of our response as a school district has highlighted and emphasized the role that nurses play in our schools, especially this time. So my understanding is the district has identified what we're referring to as isolation rooms in all of our schools. Should a student be in one of our buildings this fall that is presenting with symptoms that may appear that the child has COVID-19, that isolation room is a really important piece of that. But we need to make sure when kids are in our buildings, healthy kids are in our buildings, that they have the ability to wash their hands, that they have the ability to sanitize, that they have the ability to be physically distant from one another, that teachers have the ability to be safe while teaching our kids.
By the way, what about older personnel, whether it's teachers or janitors? if their inability, I know students might not be the most threatening source of infection, especially if they're younger, but I think there must be people in that age group who are worried.
Everybody's worried. We're in a time period that there are so many unknowns, and there's a lot of anxiety around those pieces that we don't know. But one thing for sure is our older residents we have a population of teachers that may be a little bit older, that may have underlying health issues. So there is a concern there. And as a city, we need to make sure that we're working with our teachers, with our school staff and personnel, our non-teaching staff, to make sure that they are healthy, that they are safe, that we've got precautions and protocols in place to keep them healthy and keep them safe, and make sure that they're able to still do the work that they love, and that's teach and work with our young people across the district.